Hi, my name is Odile Carroll, and you're listening to the Six Wheels Consulting Podcast with my friend Matthew Shapiro.
Welcome to the Sixth Wheels Consulting Podcast, dialoguing disability and discussing difference, inclusion, and all abilities in today's world. Now here are your hosts, Matthew Shapiro and Bob Nolly.
Hey, hello everybody. How are you? Welcome back. Welcome to the Six Wheels Consulting Disability Podcast. I'm your host, Dr. Bob Nolly, and here is my friend, your good buddy, Matthew Shapiro. Matthew, how are you?
I'm great, Bob. How are you? Happy day.
Great. I'm great. I'm glad you're great because that makes me feel great too. That's good.
Yes.
How are things in your world? We talked about football last time. I can't believe that. I've actually found baseball back now too, so that's been kind of warming me a little bit.
Yes. No. I'm great. I'm really busy. A lot of projects are kicking on all cylinders right now. So that's just keeping me going. And honestly, I'm kind of in the mood for a good old quality staycation or a little bit of time off. I feel like I've been going nonstop for the last several weeks. But I don't know if I'll be able to get that because just all these projects are kicking on high gear and staying real busy. So a lot of good things in the works here at the Six Wheels Consulting National.
I've got to tell you though, we should hold that up, and I will if you don't, as a giant example for folks out there in Listenerville for us, because there are lots of people that are just succumbing to the quarantine and adapting, and it's very easy to do, adapting kind of a victim mentality. I'm being socially deprived and I'm so this and that. And other people, such as yourself, are out there firing up projects left and right.
It's wild. I definitely consider myself to be lucky. Right now I am working off of, I think I can confidently count like 4 solid projects that I'm working on. And a few more that are kind of periphery. So I know I consider myself to be very lucky. I know there are a lot of people who are not working right now and, really struggling to make ends meet. So I consider myself to be very fortunate. It's just, it's a grind. This whole quarantine thing has been very weird because the days blend together and you blink and it's already 5 o'clock and you're like, where'd the day go? And it's been interesting. I think that's happening more now in quarantine than it was when we were not in quarantine. Like, yes, that would happen where you would blink and be like, where'd the day go? But I think that's happening more regularly in quarantine. And then also you blink and you're like, wait, it's Friday? So, it's a weird time, but it's,
yeah, that's the phrase. These are weird times. Hey, you mentioned, hey, you blink and it's Friday. My take is I've had trouble making sure I knew what day it was because I've gotten up in the morning going, all right, I got to do A, B, and C today. And I realized it's Saturday and I thought it was Tuesday. I've been that far off.
Yes. No, I know I have too. And my parents have. And I catch myself some days being like, what day is it? Because you're not sure. But I'm like, that would happen in prior, before quarantine. But like, I have found that it's happening much more frequently now because literally you're kind of only seeing the same people in the same places the whole time. So all the days sort of blend together.
Yeah. Hey, also in these weird times of COVID, the news keeps churning out. We just celebrated, so to speak, the 30th anniversary of the ADA.
That we did. We reached quite a milestone.
And looking back, you don't even have the whole 30 years to look back on. We've talked about it on the show before, but in celebrating the 30 years, what are some of the thoughts you had?
Oh wow, that's a great question.
That's why I'm here. That's why I'm
glad you teed me up for it.
Okay.
It's interesting because like I don't know a world without the ADA, right? Like because the ADA was passed in 1990. I was born in 1991, and so I've had the ADA all 29 and a half years of my life, so I've basically been around the entire lifespan of the ADA. I was almost fortunate enough to see all 30 of those years. But I mean, I can tell you I wouldn't be where I am today without the ADA. It is a law that has helped me to, live a really awesome life and do a lot of great things that we've talked about on this podcast many times. It has, allowed me to just experience the world. Yes, we have reached the 30th birthday of this great law, but I think we have a lot more work to do also. But I'm very fortunate to grow up in a time when people like me are appreciated. I certainly can't imagine what life was like pre-ADA. I've seen, documentaries around the disability rights movement and seen the great Netflix documentary Crip Camp that talked about the whole, the pre-ADA and building up to getting the ADA and the 504 sit-ins and all that great stuff. But yeah, I've been on a few ADA celebrations for a couple organizations I work with. I sent in a few videos just talking about my experiences with the ADA and how fortunate I am to grow up in this time. So the ADA means everything to me, really.
Well, that's a great perspective, and thanks very much for sharing that. I sit here with you every week, and I'm touched by that even hearing it now. So now if we lay the COVID lens over that, the mantra, the march we've been hearing in the press, so to speak, that's the lowercase p press.
Yes.
We've heard about, who are the vulnerable among us. And it's always been the elderly and those that have underlying conditions and those that should really observe the quarantine strictly and kind of hunker down. And there have been quotes about everything is being done now to protect the greatest generation and their children. But there's a group that hasn't been mentioned among those that are really at risk, and that's the disability community, I think.
Yeah, no, I think you're hitting on something you're exactly right. Like, I've seen stories throughout this quarantine of people with disabilities who have gotten sick and doctors are sort of deciding, based on quality of life, whether that person deserves to live or die. And I've heard about people who have had to ration, healthcare and medicine and ventilators. Like, luckily, over the last couple of weeks now, you haven't heard as much about the need for ventilators because I think we've finally gotten, some sort of treatments with plasma and other things where they work pretty well. But in the beginning phases of this whole quarantine craziness, there was tons of debates around, if a person with a disability showed up in the emergency room, with symptoms, there was the quality of life debate, and that really sort of pissed me off, frankly. People with disabilities have just as much a right to, be treated for this disease and any disease really, than anyone else does. And the fact that we had lawsuits from state departments and states, mandating that they care for people with disabilities and that they don't take them off of ventilators, and because some people need ventilators full time. Some people with disabilities need ventilators full time.
Yeah.
For their disability purposes, and I had heard stories about those people losing those ventilators because they, the people in hospitals kind of called them back, so to speak, to be used in the COVID crisis. And I think you're exactly right that disability has not been talked about on the same level as the elderly. You have all of these stimulus packages, and there's talk of another stimulus package, and disability is rarely mentioned as part of those, and the people that receive those stimulus packages. Like, I don't, as a person with a disability, I don't think it's solely because of my disability, but I don't get a stimulus check, whereas my parents, get $1,200, I guess it's a week or a month or whatever with these stimulus bills that have passed. And so, like, why are, again, people with disabilities not actively part of that? And you hear about policy discussions around these things. And so it has been very weird that disability has not been more of an active part of these whole...
Yeah, there's a very subtlety here. You're right. There's a very subtle point here that I think needs to be made. And it's not that a disability by itself is a risk factor. Because there's research from the CDC and all those smart folks that people with disabilities do often have other health conditions that put them at risk. And in fact, adults with disabilities are 3 times more likely to have heart disease, diabetes, cancer, or stroke.
Sure. Yeah. I mean, and that makes me nervous because I'm one of those adults, right? I will be 30 come January, and like, yes, that is still really, really young comparatively. But I mean, it's been interesting because like I've made it a point to really try and do, particularly like over the last 3-4 weeks or month or so. In the first part of quarantine, I was eating real bad. I was sort of eating my feelings. I was sort of eating my sadness. And I didn't really, like, we were eating really good food, but really bad food. You know, the good food is always the really bad food for you. And, you know, I think as of June or July, we all sort of said, you know, we need to get on a diet kind of thing. I had weighed, and last time I don't weigh that frequently because it's a bit of a process for me to get weighed. And so I had last weighed, I believe, in October, and I was at 160. And then probably about 3 or 4 weeks ago, we weighed again, and I was up to 175. So I call that the quarantine 15. And I like just knew I had to just like get my stuff together, you know. So I started trying to eat better. I've started working out with my trainer again, where he comes over to the house and we work out outside. You know, my parents still don't want really anyone in the house, but we work out outside. And then I've been trying to figure out my whole sort of therapy aspect of life too, because I think that's another huge part of this that not a lot of people are talking about, which is like your mental health and how this whole thing is affecting a lot of people's mental health, mine included. I've not been able to solve the therapy angle yet, but I'm trying to do better health habits. You know, like I said, I'm exercising, trying to do that twice a week with my trainer. Trying to eat better. This is going to sound really like novel, and our listeners are probably going to be like, well, why haven't you been doing that for your whole life? But I just started brushing my teeth twice a day, you know, within the last probably month or so. For a long time, I would only brush them in the morning. But I've been trying to get into the habit of, you know, after I eat my last meal of the night, I brush my teeth for a second time just to do that. And so I'm really trying to embrace healthier habits. And, you know, I want to see the next 30 years of the ADA.
Yeah,
right?
There you go. There you go. Well said. You touched on another point, too, that there's another reason that the disabled are higher risk for the virus is that it can get harder for you to socially distance from caretakers.
Sure.
Or to wash your hands, or to wear a mask, perhaps. And it's hard to know the full scope of that risk because there's no data on that.
Yes.
And so when you talk about your trainer coming in but not into the house, it has to be outside. So here comes a training day for you, or a training appointment. And if it's pouring down rain like it is today, even though we're evergreen, you know, you get canceled.
Well, there's some good to that and some bad to that. So like for example, when my trainer comes over, I wear a mask and I wear gloves. When we both do. He wears mask and gloves. I wear mask and gloves. Like today, with the weather being kind of shaky as it was, we decided to work out on the porch. So like he came, you know, he was able to get on the porch, and we just exercised on the porch because we knew rain was either here or coming, and we just wanted to avoid that. When it comes to washing my hands and things, like I'm fortunate enough to have enough mobility to be able to to do that myself, and I actually have a retractable head on my sink, so like I'm able to wash my left hand pretty well, and able to really get it under the sink without having to use the retractable hose. But for like my right hand, I have to pull the hose out and really rinse it down really well with the hose. But I'm pretty much washing my hands 3 or 4 times a day. I don't wash them every time after I do something because I'm basically in my house. So I know that I know where things have been and where I've been. But like after I work out with him, I take off my gloves, I wash my hands again. After, when I wash them in the shower when I'm taking a shower in the morning. I wash them when I'm brushing my teeth in the morning for another time just to make sure that they're good and clean. But I also know that like not everyone with a disability can do that, and not everyone with a disability can tolerate wearing a mask. Particularly if you're on the autism spectrum, you don't like to have things on your face or near your face.
Right, yeah.
And so how are you helping that person to socially distance or to do the right things when it comes to being a healthy citizen during this time? There's definitely a lot of hard factors. I'm fortunate that I'm able to do a lot of those things, and I'm being as cautious as I can be. It is certainly driving me crazy, as I've told you a number of times. As many people know on this podcast, I'm very extroverted. So not being able to actively go see folks and do things as actively as we normally would is tough. But I also don't know. I know a lot of people with disabilities. They know that they are, autoimmune deficient, and like they don't want to risk it. I've never been known to know that I was like autoimmune deficient, but I also am just not risking it.
Yeah, that's
right?
good. Yeah, that's good. That's a great point.
And I started quarantining probably 2 or 3 weeks before everyone else did, just because I was like, why risk it? So this week was actually my 20th week of kind of hanging out at home and quarantining, and it's been a weird 20 weeks, I'll tell you.
Yeah, I bet. Let me touch on one more point here. On top of all these practical issues, I think I've read among the disability community, people need to realize the disabled sometimes think that so much of all the rhetoric around the pandemic has been devaluing. And from the very beginning, everybody got told, yes, this is bad, but at least it's only the elderly. At least it's only the people with chronic conditions. So you don't have to worry. You meaning, a normal people, right? This is a quote now. This is told as a kind of comfort. And number one, it turns out to not be true, as people thought. Yes. And number two, even if it was a horrible thing to say. Did that chafe you when you hear things like that?
I mean, it does. It does, because basically what you're saying is like my life as a person with a disability doesn't matter, right? And the lives of other people with disabilities don't matter, because like, they already have a poor quality of life, or whatever. And it's the information that we've heard about this whole quarantine like has just driven me crazy. There's never been clarity on it. There's never really been leadership on it. And that's not a political statement. That's just a fact, right? Like, I never want this show to be political, but it's I feel like a lot of this could have been prevented, and a lot of people with disabilities probably didn't have to die. I've read some stats where I think that like 500,000 people in cognitive care settings have died. Or congregative. I can't say the word.
Cognitive, yeah.
Well, congregative.
Oh, congregative. I'm sorry. Perhaps I should cut all this out. Yeah, okay.
So like where like group homes or assisted living homes or places like that, a lot of people, particularly people with disabilities, have died in those settings during this quarantine. And to me, that is unacceptable. That is negligent, that is gross, and a lot of this could have been prevented. And it's interesting too, you brought up a second ago about attendant care and like people helping people with disabilities, and we've also seen a major, downturn in attendants coming into people's homes to help their clients, because again, they don't want people coming in and out of the home. And it's interesting. Probably a month ago, I read an article where an individual with a spinal cord injury who relies on a lot of college students to help him with his attendant care, actually one of his attendants didn't want to leave him in the lurch, so she actually started staying with him in his basement, so that she could be there to help him with care, because she was really the only one that could really be there. So, and she didn't want to risk, bringing the virus into his home or her getting the virus if she went somewhere else. And the other thing that I thought was interesting with this article was a lot of people are losing their attendance because they weren't going back to school, so they weren't in the area. So what do you do when the attendant stays in their hometown and is not in the college area where these people are who are saying that they need attendance and stuff? So there's been a lot of challenges, and it's I don't know if we have risen to the occasion in some cases, and that makes me sad, that makes me angry, that makes me want to scream and want to do something.
And that's why you have 4 projects on your way right now.
Yes, and that's why we have these podcasts and we have these conversations and we do all the work that we do. So it's been an interesting journey. It's something that we've never had to deal with before, and I hope that when we come out of this, we will sort of do a giant debrief and say, all right, what did we do wrong? What can we do better, so that if and when an instance like this happens again, we're better prepared.
Yep, I'll let that be the final word. Folks, listeners, fans of the Six Wheels Consulting Disability Podcast, we don't have our hands out to you, but we do ask you to do this. Come to the website. Come to the website at 6, that's the number 6, sixwheelsconsulting.com, and join the list and keep up and support with the work that Matthew is doing. Until next time, this is Dr. Bob Nolly for Matthew Shapiro. Think inclusion. Keep rolling forward. We'll see you next time.
Thanks, everybody.